Good morning, everybody. Doc Dave here with On Call with Doc Dave, and we are on episode number 20, which is third trimester of pregnancy. Congratulations, you finally made it to the third trimester. This is really an exciting time now. These are generally weeks from 27 to 40, and it's the evolution and final growth of the baby and the preparation of the mother. So these are things you need to know. First of all, you got to get some screening tests done. You got to get tested for gestational diabetes of the mother. You got to look for any iron deficiency anemia. And most importantly, you got to get a group B strep, which is a bacteria, testing in the vaginal vault area where the baby will come through the canal and be delivered. This is important because if the bacteria is present, the baby can get infected. And if the bacteria is present, then your gynecologist, OB doctor, will put you on an antibiotic to clear it up prior to delivery. Now, what are the physical signs of third trimester that are different from the first and the second trimester? Well, you get occasional episodes of shortness of breath, secondary to the enlargement of the uterus, which pushes up on the diaphragm. And the diaphragm, generally when you take a deep breath, the diaphragm goes down, pushes down, and allows your lungs to expand. Well, if the uterus is pushing up on the diaphragm, then you can't take a complete good deep breath. So you're breathing a little heavier to make up for that. So there's some mild to moderate shortness of breath issues, but it's nothing serious. The other one is swelling of the hands and the feet, secondary to water retention, pretty normal. Keep your legs elevated when you lay down. Try to get the veins to decompress all that fluid out of your lower extremities. Again, nothing serious to worry about. Then breast enlargement. It's the breast enlarge in order to produce what's called colostrum, which is the mother's milk, to nourish the baby after breast. That's natural as well. Then you have something called Braxton Hicks contractions. We've all kind of heard those. The layman's term is false labor, and it's the uterine's preparation and basically practice for going into full labor and having full, meaningful contractions. Other things you might notice are hemorrhoids and varicose veins in your lower extremities. It's kind of common in the third trimester and is due to increased blood circulation and blood volume. Another one, physical sign that you'll notice is more tiredness. You're going to be tired and you're going to have difficulty sleeping. Also, you're going to have some anxiety and depression, which is pretty normal during this period here. So you got to try to keep a good self-esteem and a good attitude. And it's due to increases as the due date arrives. Also going to get a little irritable with low mood episodes. So, just be aware that things are coming to a head and that these things are becoming more common, and they obviously will resolve once the baby is delivered. So, other things here, how is the baby developed at this point? So the baby development. The bones are fully developed, obviously. The organs are mature enough to sustain life. So your heart, the lungs of the baby, the nervous system, the digestive systems are all fully formed. The brain and neural systems continue to develop, but they are basically fully formed just prior to delivery. And the baby rotates around inside the uterus so that the head is down in preparation for delivery through the birth canal. Now, occasionally the baby does come out feet first, but 90% of the times they come out head first. And obviously the OB doctor will know how to adjust this if the feet come out first. They can actually push the baby up a little bit, turn the baby around so that the head comes down. Now, preparation for birth. Well, they have things called Lamaze classes and lactation classes. And your partner generally comes with you to the Lamaze class, and that'll be a supportive system that he will learn or she will learn to help you go through the contractions and relax and breathing exercises. You're also going to be doing fun stuff like preparing the baby's room, the cribs, the diapers, everything that you need to have. Do that in advance so that you don't have to be doing it when you come home from the hospital and where's the baby going to sleep? Where's the crib? Let's get this assembled. And those are kind of fun things to look forward to. They're not critical things, but you'll be in touch with your doctor more frequently as well. Now, warning signs of any potential complications prior to the delivery. Well, if you have severe abdominal pain or cramps and any bright red vaginal bleeding and it's painful, that's something in medical terms that we have a name for. It's called abruptio placenta, where the placenta actually tears away early from the uterus, and obviously that could be causing problems. So, if you have any of those, abdominal pain, bright red blood bleeding, and it's painful, you're going to be in your doctor's office or in the emergency room anyway. It's just common sense. Then there's frequency and dysuria. You kind of have a tendency getting a little bit more urinary tract infections, so you got to be careful with that, especially if you get a fever or flank pain. You may have increased nausea and vomiting, which can lead to dehydration, so this could be a problem. Dizziness and fatigue, and you got to monitor your weight gain during pregnancy. The average pregnancy gains about 20 to 24 pounds, so if you're only at 16 pounds, that's a problem. If you're at maybe 35 pounds, that's a problem. So the lower weight is just as much of a problem, if not actually more than a higher weight. Everybody tries to monitor the weight. Oh, I don't want to gain more than 20 pounds. Just let nature take its course and gain the weight you gain, and try to monitor it and use common sense on how you eat and stuff. Okay, things to avoid during this last preparation for delivery are pretty common sense. A lot of it's the same stuff you avoided in your first and second trimesters. Avoid any strenuous exercise. Avoid, again, any alcohol, smoking, or drugs if you haven't already. Avoid that caffeine because you don't want early contractions. Avoid any sushi or raw fish. You don't need any type of stomach infection at that point. Avoid lifting any heavy objects. Don't be lifting big boxes. Don't be lifting furniture. Just common sense stuff. Obviously, no gym work. And just be careful with heavy lifting. Even bending, mopping floors, and vacuum cleaning is not recommended. So, foods to avoid in this last trimester. It's unusual that you would think of these foods that you would have to avoid, but it's documented medically that you should avoid papaya, pineapple, grapes, watermelons, bananas, and apples. I don't have an explanation for each one of those, but that's what they say to avoid, so just take the experts' words for that. So that's pretty much your third trimester. Yeah, a lot of stuff's going on now, and you're getting prepared for labor, and you're getting prepared for delivery, and that's going to be my fourth and final episode of this pregnancy, which will come out in another day or two. It's going to be called episode 21, and it'll be on labor and delivery. So don't miss that one. That's going to be an important and very educational one. So hope this helps a little bit, and thanks for listening. And if you like it, don't hesitate to pass this along. Hit the like button. It makes me feel good. And remember, I'm your friend, not your doctor on this now. I'm just giving you information and educating you. So thanks for your time, and we'll connect shortly again for the labor and delivery episode.